Welcome to Healing Voices Project, where we share stories of addiction, grief, recovery, and courage. And also from people who work every day in the field of substance abuse who discuss their experiences and advice. I'm Mike Torville, your host. Thank you all for joining us. Everybody, we're back with you at Healing Voices Project, and we're glad you're back with us. Today, I have Keith Brodeur with me, and Keith is a Western Mass resident. It's good to have you here, Keith.
Thanks, Mike. Thanks for having me.
Keith is an RN who has spent 21 years working in emergency rooms and transitioned into care management about 6 years ago. And in February of 21, which is just over a year ago, Keith started a primary care model, a pilot program in Springfield that focuses on treating vulnerable at-risk populations. And of course, with that, many of those patients struggle with addiction. And Keith's program helps them through their recovery. And aside from Keith's work, which we're going to talk about, is I know you've got some personal experience, family members who struggled through addiction. And this past January, just 2 short months ago, Keith sadly lost his younger brother, Sergio, at 43 years old through addiction. So we're very sorry to hear about your brother, Sergio. And I know we're going to talk about that and how your family, yourself, dealt with his struggle over years. But I think with what you're doing now, and you're working with people with addiction prior to your brother's passing, obviously. But so you started off, Keith, as an RN for 21 years, and so you've got a lot of experience in healthcare. And so, anyway, you'll talk about that. Yeah.
I will. So I just want to correct. So I wasn't a nurse for 21 years.
Oh.
I worked in emergency rooms for 21 years.
Yeah.
Most of that I was an EMT, or emergency room technician.
Yeah.
Then 2009 became an RN.
Okay.
Continued working in ERs as a nurse, and then transitioned into care management.
So
like you said, 6 years ago.
Your healthcare career has evolved.
Has spanned 21 years in the ER. I don't even want to add that up right now.
You're right.
It's a lot of years.
But thanks for coming on. I appreciate it.
Thanks for having me, man.
Taking time. And
thanks.
I know you've got a lot. We've talked on the phone quite a bit. And so your work as an EMT and in the emergency rooms, I mean, you saw a lot, obviously. What brought your evolution, that's the word, into what you're doing now? How did that all change?
So yeah, I got into emergency medicine when I was 25 because my favorite show when I was a kid was Emergency with Johnny Gage. So I kind of always fascinated with that. So loved my time in the ER and kind of had a special place in my heart for patients who came in, overdoses or, addiction stuff, or, because I have, experience with that in my family. My mother suffered with mental health and addiction issues her whole life, so I never had a relationship with her, didn't know her. Like you said, my brother Sergio overdosed on heroin a couple months ago, and he struggled with drugs and alcohol and mental health his whole life. So that's, I've always recognized, people who are struggling, and, they have a special place in my heart. And I, want to help them because I know they're good people just struggling, with either mental health or addiction.
With your family, you were drawn to it.
I was drawn to it, yeah.
Yeah, and
right.
Like it or not.
Right, yeah, exactly, right? I didn't set off, to work in, with substance abuse and mental health because they're so, intertwined.
Yeah.
But I'm happy I'm here and I love doing what I'm doing.
And so 6 years ago, you got into care management, and it's another program. So
that's when I moved to Massachusetts from North Carolina 6 years ago, working in the ER down there, and then did a complete 180. Working in ERs is like you meet somebody for a very short amount of time and discharge them or admit them or Care management is about long-term relationships, working with patients who have low health literacies, struggling with either mental health, substance abuse, complex patients who need extra attention.
Yeah.
So that's what care management is. And then we even specialized that a year ago with this new pilot program, and are working with, a team of people now, a doctor who's a primary doc whose subspecialty is in addiction medicine, myself, a community health worker who helps patients with, housing or utilities or transportation, because in Maslow's, hierarchy of needs, if they don't have a place to live, they don't have food, nothing else, they're not going to progress anymore.
Right.
And the fourth person on our team is a behavioral health therapist,
Okay.
because that's a huge piece of the addiction puzzle is mental health.
And this is a program you started.
I helped start it.
Yeah.
Yeah.
That's
Back in February of 2021. So
So-
just over a year.
Yeah, you're into it. How's it going?
It's going great. So we're
Yeah.
waiting for data to come back.
Yeah.
Because it's healthcare and everything's driven by money. So they want to see some data to show that what we're doing is impactful. And we know it's impactful for the patients. But, is that translating to impactful, saving money for the insurance company?
Okay.
So.
Yeah. Do you work with other programs and connect with them, or is it
So
more of a
no, there's a lot of local agencies that we work with. Wayfinders is a great organization in Springfield. BHN is a great organization. AdCare in Worcester. Mira Vista, the old formerly Providence Hospital.
Yeah.
So
And AdCare, they also have an office in West Springfield too.
they do,
Yes.
not an inpatient.
Okay.
I think they do IOP, intensive outpatient program.
Yep. Okay.
But as far as inpatient detox, AdCare is a great place in Worcester.
Okay. So, well, that's great. So you're connected to several organizations.
Absolutely.
Like that, yeah.
And even more than that, like our community health worker, her name is Joanne, is fantastic and, helps these patients in so many different areas. Because like I said, if they're worried, if they don't have electricity, if they're worried about where they're going to stay, if they don't have transportation to get to appointments, they're not going to succeed.
And without it, honestly, without that kind of support, without the basic needs, it's a recipe for failure.
Absolutely.
Wouldn't you say that?
Yeah, absolutely. And then, like I said, another person on our team is Cicely, who's a behavioral health specialist. So she helps the patients get connected with a therapist, psychiatrist, IOP programs. If they're interested in inpatient detox, she helps with that. CSS programs.
And can you tell a little bit about the Wayfinder program?
So Wayfinders helps with housing. So patients who are struggling, if they're past due on rent, utilities,
Okay.
Wayfinders will, catch them up, will pay their utilities.
Okay.
And it's a simple application type thing, so it's really easy. But so many people don't know about it.
Well, that's why I'm bringing it up,
Right.
because a lot of people wouldn't know about it and
Right.
say, well, gosh, if I had only known about this program, it could have stepped up and
Absolutely,
maybe.
you don't know what you don't know, right?
How do they find? Obviously, Google Wayfinders, but is there a specific website or something that if people wanted to find out more about it?
So Google it. It's probably wayfinders.org.
Okay.
I don't know
All
exactly
right.
what the
All right.
website is.
Yeah. Yeah.
But Wayfinders is a great agency in the Springfield area.
That's good to know, because you're right, and that's partly why we do this and talk about this, because there's so much that people don't know, but more importantly, they don't know what they don't know.
Exactly.
They don't even know if something exists.
Right.
They're never going to look it up.
Right.
But that's great to know. So now that you've been doing this for a year, and you're right, you're collecting the data to see how it progresses and how it can grow and how effective it can be over just a year into it, it's still new.
Still new,
Yeah.
right?
Yeah. Yeah.
No, but we're seeing a lot of great success with patients who are struggling with addiction. The more support people have around them, the more successful they're going to be, right? So that's what we do, is help provide that extra support system and help with the things like the housing or utilities or transport, any issues that they're having, socioeconomically or SDOH, social determinants of health, right? That's a big thing in healthcare now, addressing those SDOH needs.
Yeah, those social determinants really can set a structure for people's lives. And if they don't have it, where do they resort? Well, they may become homeless. There may be, the people that they end up connecting with obviously have a bad influence versus having some structure in life. And if it's just food,
Right.
even just the basics.
Yeah.
To keep people a place to go, preventing them from being homeless or, sort of wayward on their own without that support.
Right.
Yeah. Providing that structure is a tremendous
It's
help.
so important.
Yeah. And
So
I think
important.
I would think a lot of that gets overlooked.
It does, and it's such common sense that these need to be addressed first.
Right.
Housing in Springfield's not easy.
Yeah.
It's not a magic, button that somebody presses and they get housed. But they have a lot of options, and we've seen them be successful in getting people apartments where they were previously homeless.
And so would Wayfinders, or is there a program if somebody says, "Guy, I don't have a place to live. How do I find it?" What would somebody do if they just didn't have? If they're facing homelessness, for example, and they said, "All right, yeah, I have an addiction problem. My family kicked me out. They want nothing to do with me. I'm left
Yeah.
on my own."
Yeah.
What's the next best move for them? Who do they contact?
So there are housing or homeless shelters
Yeah.
in Springfield, and I know it's not people's first choice or option.
Right.
But honestly, if you start that process with one of the shelters, getting in there and show that you're serious about getting housing, they can provide a lot of assistance. In connecting you to the right people, providing funds for you.
Okay.
So, part of that process is kind of, doing something that you otherwise might not love to do in going to the shelter if you have no other option.
Well, with no other option, right, that becomes the only option.
Right.
Right.
Right. If you do have other options, if you're able to stay with friends or family, contact Wayfinders. They have housing specialists that can help with that. Looking for places, provide you weekly new listings, and financially help with first, last, security, utilities. I mean, they financially can help a lot.
And I would think a lot of people would say, going back to that point, getting that support, people would say, "Oh my gosh, I had no idea this
Right.
this was available."
Right.
Yeah.
And a lot of people don't.
Yeah.
A lot of people don't. So, it's a great service for people out there.
Good to know.
So yeah, there are lots of pieces to the puzzle, right? To this addiction puzzle.
Yeah.
And that's one of them. Behavioral health is another big one, right? People, self-medicate for underlying depression, anxiety, bipolar, PTSD, a lot of trauma in a lot of cases, happened early on in life. So patients self-medicate. So, connecting them with a therapist that they, feel a connection with, are able to talk to once a week, once every 2 weeks, however that they need. Seeing a prescriber who's able to prescribe, medications that are appropriate for the person, mood stabilizers or whatever it is, instead of, using heroin or cocaine or alcohol.
And I think, as unappealing as it might be initially, because believe me, and we all know it because you have somebody who's struggling with substance abuse. They're wearing out their families. They've gone the path of enabling, of supporting, of ultimately perpetuating the problem, and not knowing what to do. But then there's a point when everybody said, I don't know what to do anymore. The person gets, for lack of a better term, kicked out of the house and doesn't know where to go. And, the homeless shelter isn't somebody think, well, I'm going to just go to the homeless because it's not what anyone wants to do, but it beats the alternative, right? which means just you're going to be elsewhere
On the streets.
on the street
Sure.
somewhere. But at the very least, going to a homeless shelter gives you access to people who can connect you with a better program.
Yep, absolutely.
And that's really as unappealing as that choice is. I guess what I'm thinking is, you at least have that opportunity in front of you then.
It's a first step. It's
Yeah.
a first step, and it's a door that opens that can lead to bigger things.
Right. You're
So,
not going
yeah.
to get much advice from the streets.
No, right?
So
Nope. There are agencies that want to help people.
yeah.
And if people want the help, that's a great place to start.
And I know personally, again, because with your brother, who struggled for years, and even prior to that, and I guess in starting back, and we said it earlier when we were talking, your mom struggled with substance abuse when you were as young as you can remember.
Right. I lived with her until I was maybe 3 years old, so I don't even really remember living with her. But never had a relationship with her, at any point in my life.
Okay.
Because of mental health and substance abuse.
And a few years after, I think you said 8 years after you were born,
Yeah.
Your brother Sergio was born.
Right.
And so he was your stepbrother,
Half brother.
half brother.
Right.
Okay.
Same mom, different dad.
Same. And so you didn't see him a lot in the beginning.
No,
No.
After he passed, his parents, gave me a photo album, and there's a photo of us, I think, meeting for the first time when I was maybe 12 years old,
Okay.
and he was maybe 4.
Okay. Yeah.
Other than that, no, I never really was in touch with him or connected with him
At a younger age.
At a younger age, right? He was adopted when he was 1.5 years by a great family. Grew up with a house on a lake and had a big farm in Rutland, Mass. Haying, driving tractors, snowmobiles,
Norman
boats.
Rockwell
Right?
life.
Opportunities and experiences people dream of.
Yeah.
But he just couldn't overcome the addiction part.
And you said something earlier about the addiction part, that from the day he was born, right?
The
Yeah.
odds were stacked against him. He was born with fetal alcohol syndrome, so right out of the gate, he was struggling. Mm-hmm. So, he fought it as long as he could in the best way he knew how, and we kind of all knew this was going to happen. That he would one day die of an overdose.
And you did end up having a relationship with him,
Right.
as you got older.
Yep.
Yeah.
We lived together for a couple of years out in Sterling, and we were close for years. Especially when I lived in Mass, but still living outside of Massachusetts, we were in touch when he wasn't in jail or in rehabs or programs.
Now, when Sergio was going through the programs, other family members were involved, or
Yeah, his parents heavily.
yeah.
There's a special place in heaven for them. They tried to help him as much as they could, up to a point, like, part of the disease is the stealing and the lying, and they just had to say no more. Like, you just can't come up. You can come up here maybe, for holidays type thing, but you can't stay here. He was staying in the woods, in a tent in Worcester, but that was his choice. He didn't have to. He could have, been staying in a nice house on the farm, but he had to be sober for that, and he was never ready.
That's so hard for parents
I can't imagine.
to say.
I
the
can't
obvious.
imagine. It's different as a brother, but as a parent, I can't imagine turning them away and saying, no, you've got to, I know it's cold outside, I know it's snowing outside, but you can't stay here.
That's the hardest thing ever, is it?
I
For a
can't
parent,
imagine.
yeah.
Right. Sure.
Sergio have other brothers or sisters?
So yeah, his parents had a biological child, who is a couple of years younger than Jeff. He's younger than Serge.
Okay. Yeah.
And he's a great guy. He's an accountant, just had a kid, and super guy. But he, for a long time, just kind of had to walk away from Serge because he just.
Prior to the walking away, and I think in the beginning, and I'm making an assumption here, but when they recognized in the beginning, I'm sure there was all kinds of, they wanted to support him and work through, and so there was always some element of enabling and saying, okay, you can get through it in the early rehabs or programs that he might have gone to. But then there's a point when a family says, I don't know what else to do. I've run out. And so now, with all the support we've done, and the support sometimes has the opposite effect, right? Because you're supporting somebody and you're enabling, allowing it to just perpetuate longer. There's a point when a family says, we no longer know what to do. Mm-hmm. And there's when it happens. It's like, you can't be here. Mm-hmm. And I'm sure his family was going through that whole process, right? For years.
For years, right?
Yeah.
Ups and downs and hospitalizations and, near death. I mean, he's almost died several times. I was up in the ICU with him in Maine when he fell out of the back of a pickup truck. Big head injury. He was up in the ICU in Maine for a couple weeks, then rehab in Worcester, physical rehab for the head injury. Mm-hmm. They've been through all that, and the arrests and the phone calls from jail and the rehabs and the detoxes and the programs. It's just consuming, and they did that for years, because they loved him and, wanted him to get better. But there came a point where he was going to make his own decisions. He was an adult, and everybody has choices, and he made his choices, and he had alternatives. They would have put him in whatever program he wanted to be in.
And I'll ask you this because you mentioned, but was it addiction to alcohol, drugs, heroin? What was the?
So he overdosed on heroin.
On heroin.
Yeah, he died from a heroin overdose or fentanyl.
Yeah.
But I don't know exactly what else he used.
Yeah.
Because he
wasn't always,
wasn't always honest with me about that stuff.
Mm-hmm.
So, but yeah, so most of the stuff out there is fentanyl. Heroin is fentanyl, right? And we talked the other day, like that's the leading cause of death.
Yes.
Right? The leading cause of death in adults 18 to 45 is fentanyl.
It's incredible, and I know we talked about that the other day. It's mind-boggling to think about that.
Mind-boggling, right?
More than, and you could list
car accidents, suicides, murders, COVID, cancer, more than all those things. Mm-hmm. So it's like pandemic level, right? And it reaches so many people. It happened with me. It's happened with so many people that lose family members. So that's so many people have died from heroin overdoses. Now, how many people are still struggling? Who are actively using, still struggling, but haven't died? Like, how big is that number?
Right. And part of the problem is, again, a lot of people don't have enough information, don't know what to do, are making wrong decisions because they don't have the information. But all of it is unfortunate. And there's that stigma, that word's used over and over, but it's there, and a lot of people don't want to talk about it. It's embarrassing. Or, people just feel like, I'm ashamed, or I don't want to talk about this. It's my family, or they don't understand it. That's changing, and I think the results of that are being known because the programs that exist now that didn't even 4, 5, 6 years ago, but now certainly there's some recognition of that. But I think the openness to talk about it is changing. Not fast enough.
Right.
But it's changing.
People are starting to recognize that this is turning into a pandemic.
Right.
And laws are changing in certain states like Oregon. It's getting attention on the national level. Mm-hmm. Federal, courts looking at maybe laws differently. Something's got to be done, right? Because it's going up by like 25,000 deaths a year.
Yeah.
In the last couple of years.
Yeah, it was 100,000 last year in a given period, over 100,000. And you're right. You compare that to
the year before. We were 75,000. The year before that was 50,000. So I mean, it's just growing by leaps and bounds.
And unfortunately, in the past 2 years, obviously, COVID took the headlines. Right. Mm-hmm. There was a busy couple of years with news. Right. You got the COVID that just consumed everything. You had the election that just dominated the news. You got the war, Ukraine, but seems to be that this doesn't get the national attention. It does every now and then.
Yeah, it's not sexy, right? It's not sexy news,
Right.
and people kind of want to sweep it under the rug. But now it's affecting so many families.
Yep.
It's people are going to have to take notice. It's a pandemic.
Think about what other cause of death, what else has actually reduced, what's the word I'm looking for? The age, average age for men.
Mortality rate.
Mortality. That's
Yeah,
right. Thank you. I couldn't
yeah.
think of the word, but it's actually reduced
Oh, yeah.
by a few years.
I'm sure, right?
And
Right.
that's insane.
Right.
It's had that much of an impact.
Right.
And I've said it often here. You can't find a family
No.
who's not affected by this directly. My family was affected by it.
Mm-hmm.
Yours was affected by it. And when we first started this podcast, and I wrote the book, which was almost a year and so ago, Voices from the Fallen. When I first started writing that and interviewing several people for that, I was overwhelmed with the stories. I was overwhelmed with how many people and just the conversations. Oh, I heard you're right. And somebody would come up and say, my brother or my sister or my father or my friend or my neighbor. And I was like overwhelmed with
Right.
how much
Yeah.
this is happening.
Right.
And how little, relatively speaking,
Yeah.
it's out there front and center in the news.
Right.
Yeah.
Yeah, it's the stigma that keeps people from getting help a lot of times. I hear from my patients often that they feel judged when they go to the hospital.
course,
When
right.
they go to their doctor, they feel judged and blown off because of a history of addiction.
Mm-hmm.
But like you said, I think that's slowly changing.
Slowly.
Right.
Yeah.
And I think like at Mercy Hospital, there's doctors who consult for addiction medicine. So if a patient's admitted for, either addiction or something random, a surgery, and they have a history of addiction, the consult team sees these patients and, treats them while they're in the hospital and gets them follow up from when they leave the hospital.
Mm-hmm.
So it's just got to be, hopefully the culture is changing toward a more, accepting view of this, because it's a disease and it's, like I said, the leading cause of death now in 18 to 45-year-olds. So, and as nurses and healthcare professionals, we want to help people.
Mm-hmm.
So yeah, the culture is changing and people are trying to do more of that, more of the help and referring them and, understanding addiction more.
And it is, you mentioned it's a disease, and at first I didn't understand it's a disease, but it's, and this is a while ago, and I'm learning a lot every day. In conversations with you, I learn a lot. It's a disease, and I couldn't get my head around it because I'm thinking, but it's a choice. And I thought it could still be a disease if it starts off as a choice. The same way you might get lung cancer, that's a disease, but it starts off most times with a choice of smoking. Your liver disease is a disease, but it might start off with your choice to drink excessively.
Yeah, that's a good point.
So I think this still is a disease. Yeah, it starts off as a choice,
Sure.
but it turns into a disease that you need to treat. To state the obvious, and it's not just
Sorry, this device lost its connection.
Before we were so rudely interrupted. But I think that's the thing, and it's not just come on, jump off on the horse again, get some willpower, come on, stick it. It's way more to it than that.
Yeah, no,
Yeah,
and sometimes it's not a choice. In the case of my brother, who was born, with fetal alcohol syndrome and addicted, so he didn't have a choice in that. He was born addicted to alcohol,
Right.
And he struggled with that for years.
Yeah.
People who go through horrible traumas when they're a child, how do they deal with that and process that? As adults or even younger, they self-medicate, to numb these feelings, with
Sorry,
drugs or alcohol.
I'm having trouble understanding right now. Please try a little
Is it
later.
me? Something I said?
You said the magic word.
Right.
Yeah.
She's having trouble understanding me. See you, Alexis.
Les, are we okay to continue? I'll wait if you think we should. Okay. But I think, yeah, you're right. Even especially, and it's a chemistry thing. I mean, and
Yeah.
you know how it affects the brain and
Sure.
everything else. So
Yeah.
you can't just will your way out of this.
Right.
You know.
No, I think, most of the time people, are using or doing drugs to self-medicate, some underlying, mental health thing that, is difficult to handle for them.
Right. Usually there's something underneath it. It's not
Absolutely.
just-
Yeah.
Yeah.
So that's why the, behavioral health piece and getting them connected with a therapist and psychiatrist is so important in the recovery process,
Yeah.
as is recovery coaches. Recovery coaches are amazing. And we use BHN to refer patients for recovery coaches. But, I think one of the things that patients or people lack in recovery or addiction is hope. Mm-hmm. Right. And a recovery coach kind of provides that hope for them because they've been down that road and they understand the struggles they've been through and they've come out.
They can relate to them.
Absolutely.
Yeah.
They come out successful. And so they see that person is, giving them hope.
And just to clarify for listeners, BHN.
Behavioral Health Network.
Okay.
Agency in Springfield that provides mental health therapy, counseling, psychiatry, MAT, medication-assisted treatment, Suboxone, Sublocade, methadone, a lot of different recovery coaches, a lot of great services from BHN.
Services, resources, and answers to questions people don't know the answers to.
Absolutely.
So if they go into bhn.org,
Right.
that's it, bhn.org, and there's a lot of resources. And
Lot
that's
of
a great
resources.
starting point, too, for somebody to say, what do I do now?
Great starting point.
Okay,
Yep.
that's good to know.
Yeah, absolutely.
And that's your employer?
No, that's not my employer. That's, agency that we work with.
You work with them, yeah.
Right.
Okay, just want to clarify that.
Yeah, no, I work for BMC, Boston Medical Center.
Okay,
for
that was the B.
healthcare. Yeah.
BMC, yeah.
Boston Medical Center, but the health
Okay.
plan side of it. So we work with Medicaid, patients
Okay.
who have Medicaid
Yeah.
managed by BMC.
Yeah, and I think the important thing, and again, stating the obvious here, for a family, for a friend, a brother or sister, it's hard to make decisions on your own without getting information from experienced people. So I would say before a family wants to decide what they think is right, what they think is next, is to reach out to these organizations. Because often, as it was with my family, when we went through this with a family member years ago, you make wrong decisions. And sometimes it has the opposite effect. Mm-hmm. And getting advice might just change the course of that person's recovery.
Absolutely.
Yeah. I know we made some decisions that later on we said, wow, had we only known. That's
Right.
got to be a common thought with people, right?
Right.
Yeah.
Right.
Yeah.
But ultimately it's the person who's struggling who's going to be making the ultimate decisions. But certainly having knowing what's out there for options and having support around you and knowing that there is support around you out there, it helps patients succeed.
Yeah, yeah, and there's a lot of information out there, and I think just getting that helps, even for a family to
Yeah.
process it. And
It takes a village, right? So, like I said, the more support people have around them, the more successful they are.
yeah, exactly.
So,
it's
recovery coaches and therapists and psychiatrists.
it's rare, if not impossible, for somebody to just recover on their own.
It's hard. It's a hard way to go.
Yeah,
It's a hard way to go alone. I've known people who have done it. I've had family who've done it and have amazed me at their strength. That they were able to get through, alcohol addiction without any support. Just them.
it's rare though.
Rare. It's hard. It's rare, but it's a lot easier and more successful when there are people around you who want to help and have resources.
Yeah, yeah. Well, I think too is important. A couple takeaways here with with what you've gone through, your experience, and the work you're doing. And your days must be pretty filled up, huh?
They are, right? Because like I said, it's kind of long-term relationships. These,
Yeah.
patients, rely on us for a lot of things,
Yeah.
and sometimes, just to talk or something happened with them and they just want to talk about it.
Yeah.
But we help with so many different things. We become very close to them.
Yeah.
So our goal in the program is to have these patients with us, and stabilized, whether medically or socially or with substance abuse, have them stabilized in, 8 to 9 months, and then get them back to their previous primary care doctor. So it opens up a spot for somebody else who's struggling.
Mm-hmm.
We're having a hard time convincing people, okay, you're doing much better. Now it's time to go. We're going to graduate you. We're getting some feet pushback because they're like, no, we love you guys. You've helped so much. Like, I don't want to, they haven't, not ready to leave us yet because they love the help that they're getting and the support that they're getting.
And it's got to be scary too, if they're leaving. I call it a comfort zone, for lack of a better. But if they're leaving something they've grown to be trusting and supported by your group, and then okay, it's time to go. It's got to be pretty scary.
Right. Well, we try to make sure that medically they're good. They're connected with the services they need. There are other programs out there that we can refer them to if they're still struggling.
Yeah.
With any of the social aspects.
Yeah.
So we leave them in good shape and in good hands with other people who are taking care of them.
Yeah. Yeah. And I keep thinking, not to harp on this theme, but it just doesn't get away from me, is trying to find out information. And there was a story that a friend of mine, who was a guest here a couple months ago, Dennis Gonzalez. He works with Hope for Holyoke, so I'll give them a shout out there. But Dennis and his wife Debbie were here. And Dennis shared, and Dennis's story, by the way, is featured in the book, Voices from the Fallen, and he's got an incredible story and very inspiring, and he spends every day working in this field of addiction, he and his wife. Anyway, Dennis shared a story, and he works at the ER. He works at the ER in Holyoke and also at Mercy Hospital. And he's always talking, when people come in with addiction problems, he's trying to talk and coach them through and see how he can support them. And he said one day there was a doctor who approached him and he knew what Dennis was doing, and she started opening up. She says, I don't know what to do. My husband's got an addiction problem. And she opened up, she started crying, and she says, I've tried everything. I don't know about getting a divorce. I don't know how this is going to go. We have a child. Everything's just gone wrong, and I don't know how to deal with my husband's addiction problem. I just don't know what to do. And Dennis was stunned because he thought, wait, you're a doctor. You're trained to prescribe medicine. You've been trained in this, and not specifically addiction, but just overall healthcare. And if you don't know what to do as a trained healthcare professional, how in the world is anyone else supposed to know what to do?
Right.
And that to me meant a lot. It just showed how without the information, and people just don't know what to do. So that's why I keep kind of harping on that. Reach out, find out information, talk to people like yourself, Keith, and people at the programs and at BHN to say, what help, what do I do?
Right.
What do I do? Even if doctor doesn't know.
Yeah. Right.
How are we supposed to know?
Yeah.
Yeah.
No. Our panel of patients, is small and kind of specialized, so we don't take like regular, new patients. But I did want to, give people resources out there in the community.
Yeah.
Because they're out there, but people don't know about it. So, like you said, what you don't know, you don't know. You don't know what you don't know.
Yeah, that's exactly right. Well, and I know our time is starting to draw towards the end, but is there anything else you think that we didn't get to mention that we should?
Boy,
not to put you on the spot. But,
yeah, no. So in the realm of addiction, right?
Yeah.
It's pretty broad, and you could talk for hours and days about it. And I'm so glad that you have like this podcast that you're doing.
Well, thanks.
Because it's so important, and helps remove some of that stigma and bring a spotlight to this just pandemic of a problem. Not just heroin, but alcohol, cocaine. Anything out there, and it all boils down to mental health, I think.
Right.
So getting treatment for any mental health stuff, with a therapist and psychiatrist, I think is a big piece of the puzzle.
Yeah.
Reaching out for help, you know, 2 agencies in Springfield, behavioral health, substance abuse for, you know, medication assisted treatment. There's help out there, and, you know, hopefully, all right, hold on, sorry. I lost that one.
That's all right. We have an editor.
Thank God. Yeah, so there's help out there
Yeah.
for people, and I just hope, you know, people are able to go and, you know, seek the help.
Yep, and I think that information is great because you're right. It's seeking the help, and also too, the mental health aspect of it. And a lot of people may not be aware, but there's an underlying problem that causes. It's the cause and effect, right?
Yeah.
And you think, okay, well, I'm drinking excessively because I have an underlying problem. That being solved, it may help me, you know, get past the drinking or the drugs. It's so said so easily, but doing
No,
it's another story, you know.
No, it's a big piece of it.
Yeah, it is. It is. Well, you know, Keith, what we'd like to do, certainly thanks for coming, and have you back, because I think we'd love to check in with you and see how your program's going. And you said it's only been a year. You're going through the assessment right now and
Yep.
the data, and check back with you as the year goes on to see how this is all progressing.
Yeah, I'd love to, Mike. That'd be great.
Perfect. Yeah. Well, thanks again, man. Thanks for me coming on here with me, and we will be talking along the way,
Awesome.
and also too to everybody listening. And I hope this was helpful. Thanks again for joining us, and see you soon. Thanks.